Okay, the hint for the second case was that this patient did not want to wear heavy orthotics. KAFOs are always going to be heavier than AFOs, and they're way more cumbersome, they're harder to get on and off. The compliance level goes down when an individual has to wear a KAFO versus an AFO. So you always want to try AFOs first. You know, if somebody has a quad around 3 or 3 plus, you definitely want to try that AFO first and position the ankle to help control the knee. So in this case, I was looking for you to go to bilateral AFOs and set the ankle, a solid ankle, because his ankle was extremely weak, set the ankle into a little bit of plantar flexion, 2 to 3 degrees, to see if you can control the buckling at the knee, because he did have some quad control. A lot of you still went with the KAFOs because I think that's where the roadmap initially takes you. But if you look closely at the roadmap, there is an exception rule for a person who has good hip strength. And if somebody has a hip extensor strength of 3 plus and their quad is 3, they may be able to get by with a AFO. So again, just to think about your patients, and if they do have some quad control, always try the AFOs first. And if you can't get control there, then move to the KAFO. So that's what I was hoping you would get to. Some of you did get to that, but a lot of you went straight to the KAFOs, and that's fine, but I want you to at least think about the option of an AFO, because again, your patient's compliance levels is going to tank with a KAFO. Now, those of you who did go to a KAFO, a few of you were going to keep the ankle in dorsiflexion and thinking that this person would need a swing through gait pattern. The swing through gait pattern is for someone who's really paralyzed from the waist down and has no control and relies 100% on bracing to give stability. This individual has an incomplete lesion and has some muscle control, so he doesn't have to entirely rely on the bracing. So this individual will have a reciprocal gait pattern where one foot is moving first and then the other foot, because he does have sufficient muscle control at the hip and the knee to do so. You know, he's got 4 in his hip flexors, 3 plus in his hip extensors, so he's going to have no problem at all advancing with his hip muscles. The swing through pattern for the paraplegic with complete paralysis, they're essentially walking with their upper extremities and lifting up. You know, through scapular depression, the legs come up off the floor and swing through more passively, and then the bracing provides stability during stance phase. So make sure you've got that clear in your head, that this individual would not need to use that style of walking, and that's a common mistake, and that's why I wanted to do this video to clarify that. If you have any further questions about that concept, please contact me. Thanks.